After age 40, it becomes much more difficult to lose weight, especially for women, but it is possible. So don't click the X. Today, we're going to talk about the steps that need to be taken so you can start losing weight and feeling great again. I'm Dr. Jake. I'm a naturopathic medical doctor and integrated physician. On this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgery. Be sure to subscribe for more videos like this one. Okay, let's jump in. Yeah, so let's talk about why is it so difficult to lose weight after age 40? So a big reason for this is our metabolism does decrease over time. We actually start degenerating after age 25. That's pretty depressing. We reach our maximum potential at 25, which is just sad in my mind. But that's what happens. We're at our max and then we just decrease and decrease from there. And our hormones are going to be decreasing. After the age of 25, our testosterone keeps decreasing over time. And then over the age of 40 for men and women, testosterone starts getting low. And then for women, estrogen and progesterone start getting low. Then it becomes very difficult to lose weight around your abdomen and your hip area. And then, like we talked about metabolism, when you get older, it's going to be slower. So you're not going to be able to eat whatever you want at that time because your cells aren't taking up as much energy. Your mitochondria aren't firing as well as when you were younger. So those are really some of the main causes why you're going to gain weight more at that time. It could also be because a lot of people in their 40s, they have kids now, and there's a lot of stress going on. So we need to work on dealing with that too. Yeah, let's talk about what should we do exercise-wise to help us lose weight after the age of 40. So we need to not just do cardio. That is a piece of what's going on, what you need to do, but you need to really pay attention to your exercise routine. And it's not just being cardio. You need to really do a lot more muscle workouts. You need to tone your muscles. That doesn't mean you have to go to the gym and be a gym rat and just lift a ton of weights, but we need to increase our muscle mass. The more muscle mass we have, the more weight we're going to be losing just sitting on the couch. The more food that we are going to be able to eat because it's metabolically active tissue and fat is not. When you go running, you are not building a lot of muscle. You're actually losing a lot of muscle, especially if you are not getting enough calories in based on how many calories you're burning when you are running. So you're going to be starting to lose a lot of muscle. You might be losing some fat, but you're going to be losing a lot of muscle. You're going to be maintaining some of that fat on there. And then, like I said, less muscle you have, slower your metabolism is, and you're going to be gaining a lot of weight when you're just sitting around. So it needs to be a fine balance. Cardio is good, and you need to do it with your heart rate at the right rate. So you could do interval training. That's okay. You could do non-interval training. That's fine. But you want to make sure at least 2 days a week, up to 3 days a week, you want to be doing some muscle workout. And that could be as easy as even doing Pilates if you're actually working on building your muscle tissue. But whatever workout that you want to do, you need to be working on increasing your muscle mass. But also, we want to do aerobic workouts that are increasing your heart rate. So we want to keep your VO2 max at about 60 to 70%. Usually that means you can talk to the person next to you, but it's not easy. And we want to do, depending on the person, 30 to 60 minutes, maybe 3 to 5 times a week of cardio. And then we're doing 2 or 3 times a week of doing muscle workouts. We want to not be pushing ourselves too much that we are so depleted, we are non energetic. We don't want to boost too much cortisol. So we need a fine balance of what works for you. And you really need to go to a doctor, really know what is your body type, who are you, to really formulate the best exercise routine. Would it be important to order some labs to really see where your cortisol is at, or maybe some hormonal workout? Definitely. I do this every patient that come into me. I'm going to be order specifically what's going on with their cortisol levels. I like something called a diurnal cortisol, and it is a spit test that you do at home. You check your cortisol morning, afternoon, evening, nighttime, and we get to see what your cortisol is doing. We get to see, okay, you're making too little in the morning, you're making too much at night. Or you're like, oh, I'm making enough in the morning, but I'm dropping in the afternoon, or vice versa. Or you're just making too little cortisol all the time, or you're making way too much cortisol. So the testing really helps us know how to approach your cortisol issue, because it might be we need to give you cortisol. It might be that we need to calm down your cortisol, or it might be we need to just change it on certain times of the day. So that's very important. But like I said earlier, is that we want to check your hormones. So we want to check your estrogen, your progesterone, your DHEA, your testosterone. Also, after 40, your thyroid starts to not work as well as it used to. So we want to see how your thyroid is doing. Do a very detailed workup like a TSH, a free T3, a free T4, a reverse T3, autoimmune antibodies. Really get a good look at what's going on there. I like to check for food sensitivities and multiple other tests to really see how the body is working too. But those are some of the basics. Let's talk about the specific diet that we need to do after 40 years old. This is going to change from person to person. There is not just one diet that's going to make someone lose a lot of weight. But what I do see in almost all my patients is those that have difficulty losing weight, they usually are eating a food that is inflammatory to them, which is then decreasing their metabolism. They might be eating gluten or dairy, corn, soy. Those might be a problem. But maybe those aren't a problem. Maybe they're even eating healthy foods like broccoli or spinach that's causing the inflammatory process with them. A lot of people that have tried already to not eat too much food and exercise, usually there's something going on with their gut. Their microbiome is messed up. They have a food sensitivity. I see this all the time. So we need to check these food sensitivities. And I see people lose the pounds in a healthy manner when we take away these foods that they're reacted to. But let's say someone doesn't have a food sensitivity. The diet that I like is you want to eat lower carb. The reason why I say that is you don't want to eat too many carbs because what happens when you do, it has this spike of insulin. And insulin is the storage of sugar in your body. So let's say you get a big spike, the insulin is going to be produced, and then that's going to shove all the sugar inside your cells. And then that's just going to turn into fat. Also, you're going to have these big waxes and wanes of your energy levels. So you're not going to really want to work out when we do that, anyways. When we do have a carb, I recommend you get some protein with it because you're not going to have as much of the spikes. You're going to get some fat in it. I'm not saying don't eat any carbs. You just want to eat lower carb and you want to get much more protein in so you're able to build more muscle, which we want. Let's say you're eating a lot of carbs because you're running a lot and you're not eating enough protein, which can be very difficult. And I see most people are really aren't getting enough protein in their diet. You're not going to gain the muscle and you're not going to be able to have a fast metabolism, which we all want. So you want to make sure you get enough protein in your diet. Zero point 0.8 milligrams per kilogram is the minimum you need. But let's say you are working out like I said you should, you want to get at least 1 gram per kilogram of protein per day. And if you really want to build tons of muscles and you're a muscle builder, you want to get 1.2, or if you're an athlete, you want to get 1.2 milligrams per kilogram, which is a lot of protein. Most people really aren't getting that zero point 0.8 milligrams per kilogram, especially if they're vegan. They usually aren't getting that in. And even people that aren't vegan and eating the omnivore diet or just eating the SAD diet, many times they aren't getting enough good quality protein in their diet too. So that's really my favorite diet. Get enough protein in, don't eat way too many carbs. That's really the basics. So each ounce of meat has a certain amount of milligrams of protein in there. It's easy to Google search. You could be like, I have 6 ounces of steak. This is the milligrams of protein that I'm getting. And you could calculate that just to figure out what are you doing now? So just for like 3 days, figure out what are you currently getting in protein wise. And you could be like, am I getting enough or not? And if you're getting enough, you're probably good in your typical diet. If not, you need to be like, I need to add some more protein in my diet to really build muscle tissue. Are there any supplements that we can take to actually help us lose weight? Yes, there are. It's not like, oh, I take these supplements, I'm going to lose weight. This goes along with what you're doing, the diet, the exercise. You can't do these alone. I haven't seen these just work by themselves in my experience, but they really do help a lot if you are doing all these other things. So the first one I want to start with is berberine. And this works similarly to metformin. Metformin's getting a lot of research hype out there to helping people lose weight because it balances your blood sugar. Berberine works in a similar way to metformin on helping balance out your blood sugar regulations, but it's a natural supplement that we take and it doesn't come along with the side effects that come along with metformin, like the digestive upset, diarrhea, etc. And berberine, what I really like about it too is remember I talked about the microbiome being a piece and a cause of why people aren't able to lose weight is berberine helps balance out our microbiome. It helps kill all these bad bugs that are hanging out in there and helps gives the good bugs in there a chance to start replicating again. So berberine is awesome. It helps your microbiome. and it's going to be helping balance out your blood sugar at the same time. And there's good research showing that actually help people lose weight well. They're going to help your mitochondria work better. So we help your mitochondria work better. They're going to be firing in all cylinders, making ATP and burning calories much more efficiently. So we want to help support that. So we want to give like acetyl L-carnitine. So when we do a supplement, acetyl L-carnitine is very important, not just L-carnitine. It's not going to absorb as well. You want acetyl L-carnitine. Now, there are some people that have bad guts and they have a dysbiosis going on, and acetyl-L-carnitine has a possibility to increase something called TMO, which isn't good for your blood vessels. So take it or leave it. If you think you have digestive issues, you might think about doing actually an injectable acetyl-L-carnitine. You don't need acetyl-L-carnitine when you do injectable intramuscular L-carnitine like twice a week. You could get that from a doctor, whatever, and that can work really well for those people that might have those issues. And some people don't digest it very well, so that can work really well that way. I like to add this with a little bit of MIC, inositol, methionine, and choline. That helps increase metabolism also. I really like something called alpha lipoic acid. You could do that injectable, but you really don't need to. Oral is just sufficient. That's going to help support that. Glutathione is going to be very beneficial. CoQ10. These are all things to really boost your metabolism that's going on in your body. Last one that I just want to talk about is green tea. Has good research on boosting the mitochondria and being antioxidant, anti-inflammatory, and that could be beneficial for losing weight also. Are there any other treatments that you can do that can help speed up the fat elimination process? Yeah, so we're in 2023. There's so much technology out there, a lot of great treatments out there that can really be beneficial and really work on you losing weight in a natural way. One of these treatments is called the M-Sculpt Neo. It's a really cool technology. It uses a high fem radio frequency, and what it does is it helps your muscles in your abdomen contract, or you could put it all throughout your body in areas that you want to lose weight. But many times, especially women, men have this issue too. They have this belly gut. They lose weight in all these other areas, but they can't lose it quite efficiently in their abdomen, especially after having babies, because then they stretch out their muscles. They don't quite go back to where they were. And it's really hard to build the abs again and actually lose the fat in the abdomen area. M-Sculpt Neo works by strengthening those muscles. So it's like doing 20,000 crunches in a 30-minute period at 100% contraction. Most people can't get 100% contraction. All you get is a 30%. When you do a crunch or a sit up, you do a 30% contraction. Obviously, I don't think many of you probably have, maybe you've done 20,000 in your lifetime, but that's how many contractions you're doing at 100%. So you can't really do this yourself to get what the results this is getting over in a 30-minute session. But all you need to do is do 4 sessions. It's going to increase your muscle mass in your abs by 25%, decrease fat by 35%, and decrease visceral fat by 19%. Visceral fat is that bad fat around your organs, which increases chronic disease like diabetes, cardiovascular disease like heart attacks and strokes, and cancer and autoimmune disease. All these things have research linking them to visceral fat. So you're not only going to look better and feel better, but you're going to be much healthier when you do this technique. So yeah, if you want to get a hold of me and get some help with your weight loss journey, visit my website, integrativemedica.com. Visit my phone number there. Give me a call, set up an appointment with my receptionist, and you can set it up with me or some of my other great doctors. You could also just set it up on Book Online tab that we have on our website. And you don't necessarily have to be where I live. We could do this all virtually and get things going for you. If you want to learn more about losing weight or eating healthy, click on my videos to the right. I'm Dr. Jake, and I'll see you there.